Dr. Zenawi, I am starting now.
Okay.
Welcome, colleagues, brothers, sisters, and friends from. I see that we are not joined by many people, but as they say, the size of the audience does not matter. So here we have arranged this webinar to discuss a research paper, an assessment paper done in Tigray by HAQI Foundation. And it involved a lot of scholars in Tigray and outside Tigray. So the title of the assessment conducted is the state of professionals and service provision during the war in Tigray. And it focuses on education and healthcare in focus. So as you all know, the war in Tigray has affected everyone, every part of the society. But HAQI decided to focus first on the healthcare workers in Tigray and teachers in Tigray. So the background, the budget has been cut, salary was not sent, banks were not functional. There were a lot of war going on, days. So in this environment, how did the healthcare workers and the teachers felt? So this is the research was conducted throughout Tigray, so that what was the finding will be discussed by Dr. Zenawi. He's the lead researcher together with other scholars abroad and in Tigray. Then after he has presented for the next 50 minutes, we are joined by Dr. Tedros from Health Bureau. So he will give him a chance to reflect, and following that we'll have a discussion for an additional 1 hour. So Biron, it's going to be a remarkable presentation, probably the first official scientific paper coming from the closed of Tigray, and it's going to touch your hearts. So let's attend. I leave the floor to Dr. Zenawi, and I beg for your attention. Thank you very much. Dr. Zenawi, the floor is yours now.
Thank you so much, Dr. Fasika, for the introduction and kind words. As you can see on the screen, the state of professionals and service provision during the war in Tigray, education and health in focus. That is the theme of the presentation. So before we go into any further ado, I think we have to first acknowledge the day the presentation is being held. It's March 8th, International Women's Day. And I think there is every reason for us, especially in Tigray, to celebrate this day because of the dedication, determination, and sacrifice paid by our dearest women, sisters, mothers, daughters. So we cannot thank them enough for all the bravery and the dedication they have done to say no to injustice. And I think it will be fair enough to give them due recognition in this presentation. Just a little bit about who we are and why we are constituted. I think just to give you a brief outline of what HAQI is, as you can see, it was constituted by like-minded Tagaru who would like to make a difference to what is happening against us all, against our identity. So we just want to make a scientific contribution into making a difference to the lives and livelihoods of our people, ourselves for that matter. So that's what HAQI is all about. Just to give you, for those of you who are joining us from abroad, and perhaps for those who do not have a good knowledge of what Tigray is, where it is, just a brief indication of where we are, which country, which region borders us, and although the data on the population number could be debated, I think this is, as far as the published reports are concerned, 6.14 million people is believed to be the population, but recent figures could change. Just to give you a bit of background into the health sector. Well, the health sector is constituted in 3 tiers, as they call it. So the tertiary care is supposed to serve from 3.5 to 5 million people, and unfortunately, we only have 2 tertiary care providing centers, and you can imagine what it means when a damage happens to the only 2 centers. What does it mean to these people? I think it's anybody's guess. So this is anyway how our health centers, healthcare institutions are constituted. So the rest, as you can see, most of them are lower level service giving institutions, but still they were even the targets of the war. And on my left side, you have healthcare facilities and healthcare professionals. So compare what it means. You have the number of population indicated in the previous slide, and you have 19,000 healthcare professionals, and they have been impacted very severely by the war. So add up all of this, and you can make your own inference into what it means. When it comes to the education sector, in fact, we do not boast about having enough numbers, but at least we had a good number of schools, teachers. We had peace more than anything else. I mean, although we may not have a good education to boast about, but at least we had peace. We were sending our kids to schools, and that was not possible now. So yes, that tells the reality that we are in. So it's in the middle of all of this that the war erupted, and as you can see from reports 6 months into the war, this is what happened. 27% of hospitals were functional, just 6 months. You can imagine what it means now, after all what has happened. But at least reports coming out after 6 months indicated these figures, and you can imagine what that means to the population going to these centers, looking for medical assistance. The same, even worse, is the case when it comes to education. You can see almost all of the classrooms are gone, the desks, blackboards, computers, what have you. Anything that is useful in the schools is gone, just 6 months into the war. So this is not our assessment. These were assessments already there when we decided to start conducting the research. This was a reality. So I think it says it all. It says a lot of interesting stories as far as what was going on is concerned. Okay, so why did we decide to conduct the study? Well, a number of issues could be considered as reasons, but to be specific, when trauma occurs, I think many of you are health professionals, so you can imagine what it means to our normal day-to-day functioning. So we had to be serious enough to study what exactly has happened when it comes to the mental health of our healthcare professionals and our teachers. Because if we don't address that, absenteeism, impaired judgment, low productivity, poor quality of work, all the things that are listed here will happen to a professional, which by implication means they will not be able to provide the service they are supposed to provide. At the same time, we had to check whether the institutions they are serving also have some kind of caring system put in place, trauma-informed care, if at all there is. So we had no idea whether that is in place. So like I said in the previous slide, So we had to check whether healthcare facilities and schools are severely being impacted by the war, although preliminary reports were indicating the same, but we need to make sure that there is indeed a severe impact on the healthcare facilities and schools. We also need evidence on the level of impact on workers, because that was not clearly being indicated other than the bits and pieces of information that were trickling into the international community. There was no way for anyone to check whether that is in fact real or not. So we had to take the courage to go down into the grassroots, check what is exactly happening, and come up with the scientific evidence to convince the international community what is happening. So these are the reasons. So to just give you a specific reasons why we conducted the studies, we had to assess the extent of the war-related events as reported by the subjects themselves, not just the secondary reports, but the people who are courageously doing what they were doing at gunpoint when life was such a challenge. So we had to go down, talk to them, sit with them, and see what is happening. So we had to also study the impact of the war on mental health using some standard measures, and then conduct some exploration into the effects of the war on the quality of the service being provided, both in education and in health. So that was another reason why we conducted the study. And finally, any emergent needs. What do they exactly need? Living in these conditions, what exactly are they expecting from anyone who would like to help them? That was still another reason why we conducted the study. We conducted our methodology, just to give you a brief outline into the very meticulous methodological approach we followed. Our major approach was cross-sectional, where that the qualitative and quantitative approach have been designed. The study was conducted between February up to March 2022. Then think about the timing, and you can then guess how brave our data collectors were to go to the field without even having modest paradigms, just surviving using some dried biscuits and basso and tahini, what have you. So that's the time when they conducted the study. Our respondents are healthcare workers and education workers, as you can see. We say the number is huge given the circumstance we're talking about. So it's a big number. Dr. Fasika was mentioning that it was conducted throughout Tigray, but Tigray by then was only the Tigray other than the western and the northwestern Tigray. That obviously was under the occupiers by then, so we were not able to talk to these people, but at least some of them made it into where it was safe. So perhaps some of our informants were also from these areas. Our sampling technique was multi-stage. We started from the zones and the waradas and the schools, and the same is true with the health facilities. That's what we mean by multi-stage sampling. What tools did we use to gather the kind of data we gathered? A number of tools that were appropriate for the issue we're talking about. So one is the War Events Questionnaire. Most of you know this. It's a widely used questionnaire in areas where there is a conflict. So we used that tool, a modified version, of course, to fit into our context. The Hospital Anxiety and Depression Score scale was the other scale we used. A Crisis and Trauma Resource Institute scale for mental health outcomes, Trauma-Informed Care Questionnaire, and last but not least is the Positive Characters and Strength Scale, which is adopted from the debates in positive psychology, which Ligman and his colleagues have been propagating for many years. So these were the tools that we relied on for the quantitative data. qualitative data, we had leading questions presented under IDI and FGD, which were obviously, as you know, have been modified and open for additions when we went into the field and when data came up from our discussions with our informants. Anyway, these were our data tools. We're very, like I said, very meticulous, very critical when it comes to following ethical standards, without which we cannot come up with any scientific study. So we had to get an ethical clearance after all our tools have been approved by the Institutional Review Board at IDER. We also had the go-ahead from the two sectors for whom we were conducting the study. So we presented everything to them, they approved it, so it was based on their approval that we have conducted the study. And finally, consent of our informants was very important, so we did everything we had to do to make everyone part of the study. Data analysis, both quantitative and qualitative techniques have been employed, descriptive, chi-square, regression using Stata, and then thematic analysis using the DDoS version 9 have been used. Okay, now to briefly present our findings. This is just an outline of who our informants are as far as their demographic characteristics is concerned: age, marital status, educational status, family size. We're more. I just want you to see attentively on the marital status. As you can see, most of our respondents were, a majority of them, I would say, at least married. And think about what it means. So the whole family is being impacted by just looking into the marital status, and also look into the family size. 2 to 4 number of family size being impacted by the war. What does it mean? You can take your own judgments. Okay, now to the impacts of the war on healthcare and education. We had to ask them any kind of damage that they sustained out of surviving in the war. So as you can see, house damage, at least 35% of the informants say their house has either been completely demolished, partially demolished, or just impacted by a shrapnel. But in any case, at least a third of our respondents said that their houses have been damaged. We also had to ask them if they had been impacted physically. So this is a good number, 18% in the case of healthcare workers, and 20% among the teachers have been impacted physically, either by a shrapnel or by fire bullets. They have, in fact, been imprisoned as well, perhaps because of providing their services, and perhaps because of who they are. For whatever reason, imprisonment was also something that they have experienced. We also had to ask them if they have witnessed any sexual abuse. So as you can see, more than 75% of them responded they know at least one woman who has been forced to have sex without her consent, and almost 50% of doctors and 51% midwives and 3% nurses treated at least one victim of sexual abuse, and more than 20% of the healthcare workers treated at least one victim who experienced this kind of degrading or unusual sex. So I think this speaks volumes as far as what these people have experienced in concert. Dr. Fasiga, when he introduced us about the situation during which we conducted the study, he was mentioning about no salaries, no food, this is a reality, as you can see from the tables. Almost everybody was doing what they were doing without getting a penny, and there was no food and water, shortage of transportation, medicine. So this is a reality. The healthcare professionals and teachers were doing what they were doing amidst all the challenges. Now we will move into their mental health status. Let's start with anxiety and depression. One may say, well, anxiety could be expected even under normal circumstances. When you have a very demanding job, you might feel anxious or depressed. But we're more concerned not just on the anxiety, have a look at the level of the anxiety. It's abnormal. Most of them have experienced an abnormal level of anxiety. So by any measure, I think it's very high. So that's even more concerning. Not just the anxiety, not just the depression, but at what level is the anxiety is what is more important to note. And if we think of, doing interventions, we have to think about what it means. Burnout and compassion fatigue. The same is true when it comes to these indicators. So you can see the burnout is moderate and high, very high. So that's really frightening. So unless something is done, I think we should not expect these professionals to do a healthy job and provide service to the needy. Vicarious trauma and sleep disorders, the same here as well. I think it's high and very high in both healthcare workers and education workers. So I think it's a bit concerning and needs serious intervention. Mental health crisis, just a summary of what we have been looking so far. So anxiety, depression, burnout, compassion fatigue, vicarious trauma, trauma-associated sleep disorders are very, very high. If you look into the percentage of people who reported that they have experienced that kind of a mental health situation, it's a bit concerning, like I said earlier. By health facility also tells interesting stories. So you can imagine the burden is very high in areas where the health posts are concentrating, because most of the people will be going to look for medical assistance to this center. So you can see the numbers being a little higher than others when it comes to health posts. Although the burden is everywhere, but when it comes to health posts, the burden is very high for understandable reasons. We also had to look into the kind of mental health by the level of education. By the way, we didn't have secondary schools. We only had primary schools, but we had secondary school teachers who were assigned in the high schools to assist the primary school teachers. So that's what we mean by secondary schools. Otherwise, secondary schools were not operational when the Tigray regional government resumed power after June. So this has to be taken into account. So one may wonder, how on earth were these health professionals and teachers doing what they were doing, having seen all the levels of anxiety, depression, burnout? So we have to make sure whether these people are, mentally strong. So this character strength or resilience, had to ask them questions like, I do what I do, assuming that tomorrow will be better. I do what I do because my people are much better than my personal comfort. Those kinds of questions were presented to them. So amazingly, most of them indicated that they have higher scores, which is why perhaps these people have been doing their job professionally amidst all the challenges they were experiencing. We also had to ask them to tell us if the hospitals, the health centers had anything that relates to taking care of their level of trauma. And as you can see, some of the questions, if there is a monitoring mechanism put in place, if training is given in relation to trauma, if workforce has been developed in relation to, creating a trauma-informed culture in the institutions. So most of them said not very much. I mean, it's not common. It's not a culture in these centers to have a trauma-informed system. The same is true with the education sector as well. The schools, the education system in general does not have a trauma-informed system in place because most of them said it's below what is expected. And then finally, to our qualitative results, which is, in fact, very much emotionally challenging to listen to the stories as reported by our informants. And we try to thematically categorize them into 6 based on the responses they gave us. So the first category is the good old days, where most of our respondents were starting to, remember how good the time before the war was. Like I said, we may not have had the best schools, the best hospitals, but at least they were providing at least a minimum service. And when it is gone, we understand how dear peace was and how much we have lost it. So that's the kind of expression most of the people were using. So as you can see, this is just one example. We had this, we had that, we had ambulance, mothers were delivering in hospitals, but all of it is gone like a blink, with a blink of an eye. The second thematic classification was destruction and violence perpetrated in the community. So they were telling us very difficult stories to listen to. As you can see, the hospital is being demolished, everything taken away. Whatever remains is burnt down so that it will not be useful afterwards. Whatever they can carry, they carry it. Whatever they cannot, they just burn it. So that's one good instance that has been reported by our informants. The same is true with the schools. When the invading forces came, they took everything, literally everything, and there is nothing left in the schools now. What they have done, violence is the second one again, under the second theme. I saw girls who were victims of sexual violence, gang rape by invading forces. Many women have been affected by vaginal and other fistula after rape. This is a story sometimes very difficult to listen to, especially as a member of the Tigrayan community. Also, listening to these stories is very, very challenging. People witnessed dead bodies in the streets because it was not possible to bury the dead. And it's not only witnessing the dead, but witnessing the dead eaten by dogs and hyenas. You can imagine the trauma that it leaves to the survivors, and I think it's quite a challenge. Realities of day-to-day living. Well, it's quite a challenge to also listen to people. They have enough savings in their accounts, but they cannot do anything. They cannot buy stuff for kids. and they have been telling this experience. Emergent mental health concerns were also other issues reported. Something like school kids being disturbed when they listen to any just simple sound of a corrugated iron sheet hit by a stone or anything. That's one instance they just mentioned how stressed people have become. Suicidal case is another case. I would like to read this story. A 14-year-old boy who used to support his mom by working with a local carpenter for half a day and going to school the other half, committed suicide. Why? Because he couldn't bear to see his starving mother begging for food in the neighborhood. I mean, this is what is happening to our people, and I think it's quite a challenge to even to listen to these stories. The experience of professionals, because I mean, trauma is everywhere. The patients coming to the hospitals are traumatized. The healthcare professional is traumatized, and to think of giving service in such a context, in such an environment, is quite a challenge. So they are even exposed to vicarious trauma as a result of working, trying to help traumatized patients. So I think all these stories speak volumes as far as what we have to do is concerned. So to just conclude, I think we need to come up with very important points. The carnage perpetrated by the invaders and poor living conditions have significantly increased the health service of the community, which means there is an urgent need to address the mental health status of the community and the service providers. This is very important. So this is what we learned from all the stories that I have been narrating to you guys so far. And I think the question is what next? I mean, this research is not something to be shelved like all other research we know, or perhaps maybe to contribute to knowledge. This is not something we did for the sake of knowledge or for the sake of publications. This research is done for a noble cause, and that is we have to urgently help the community so that they can feel better and do what they do afterwards. So we immediately started developing proposals, and we're trying to submit to funding institutions. So at least some of the proposals are presented here. For example, one is scaling up community-based mental health interventions in post-war Tigray is one good proposal that focuses on providing trainings to nurses and lay professionals so they can afterwards train the communities on MHPSS after conducting MHGAP analysis. And the second one is self-management toolkit for mental health recovery in Tigray, which is kind of a self-help guide to be used by anyone who has traumatic experiences. So it's like a small book, a handy book to be provided to anyone who has this kind of a challenge. We're also thinking of establishing a helpline where people can call and get medical assistance, psychiatric assistance from professionals through phone calls or through radio broadcast. We're also thinking of introducing mental health in the schools to improve education and to propagate peace in our primary schools through providing trainings to teachers, through radio programs, school-based and regional radio programs, so that we can teach them about psycho in a concept called psychoeducation. We're trying to address all these issues. Introducing trauma-informed care into the health and education sector is another area that we're working. In fact, we also have been in contact with the health sector and education sector. It has been approved by them. They are now, the management is now closely collaborating with us. And hopefully, if we get some funding, we'll be starting shortly to provide training to staff members in schools so that they can think of, introducing it as a culture up to the grassroots, up to the school level. We have also developed a proposal on school feeding programs. As you know, school feeding up until now the concept was only for school kids who are hungry. Now everybody is hungry. Even the teachers cannot think of conducting their routine if they don't eat. So we're now thinking of feeding the teachers, feeding the school community for that matter. Not just like a food delivery system, but to make it more sustainable, we also plan to teach them how they can have a school garden. So eventually the school will develop to feed itself after some time. We're also involving the community so they can contribute to the cooking the food and perhaps contributing some proportion of whatever is being provided into the school. So these are some of the proposals, and there are a lot more coming in the pipeline. Thank you very much.
Okay. Thank you very much, Dr. Zenawi. It's a very, even if it is sad, this is a story you narrated wonderfully, and you have described all the process we have passed through, and you have described the finding. So now I would like to invite Dr. Tedros Gomezai from Health Bureau to reflect on the presentation, and from the government side also. So I would invite Tedros Gomezai. And please, Dr. Zenawi, hand over the host to Daniel, our web administrator. Dr. Tedros.
To be informed about the level of trauma our healthcare providers are sustaining. I think this research is the first of its kind. For so long, we have been studying the level of damage in terms of infrastructure, in terms of displacement, in terms of days, and in terms of other issues, material issues, and not really what happened to those survivors of the war. And the figures are very alarming, and the sample size is very significant. So one can surely say that it actually represents. So around 559 healthcare workers is a very large sample size, and it's also studied across all the level of care, starting from the primary up to the tertiary level of care, and it was a very good assessment. And what happened to the healthcare providers is very, very saddening. And not only the vicarious trauma they are sustaining, but also they were sustaining a direct trauma. They were being imprisoned, their livelihoods were lost, and their families separated, and everything was clearly depicted in this research. What I would like to comment is I was somehow looking for the level of PTSD, post-traumatic stress disorder, to be mentioned. But it was a very clear presentation. And regarding the response, I think the modalities are very nice. Scaling up of community mental health interventions. It's good that HAQI is coming into this community mental health interventions. There are already some existing modalities, so like the self-help, which is to be piloted in women's development army, what they call ልማት ጉጅሌ in Tigray. They can have their own kind of discussion, but this is specifically for healthcare workers. It's a good other kind of initiative. And the trauma-informed care, it's a very important idea, not only for education sector, even for health sectors. Even if we provide a trauma-focused care, we are not trauma-informed in addressing each other's, even clients. We re-expose people for re-traumatization, and we are watching currently here and there. There are some complaints that came to the bureau. So it's a very important area of improvement. And again, I would like to say thank you for giving me this chance, and we will work in hands together.
Thank you very much, Dr. Tedros from Health Bureau. Mr. Takhlu from Education Bureau could not join us, but the Education Bureau were involved from the time of inception all the way up to the write-up of the manuscript. So now we'll go to questions and discussions, comments from participants. If you raise your hands, Daniel, our web admin, will give you a chance to reflect, to ask, and to discuss all the presentation. So for those of you who have joined us late, this study was conducted on healthcare workers and teachers in Tigray region, and their mental health status was assessed using standard quantitative tools and qualitative methods. So the results are very dismaying. There is anxiety, there is depression, there is all spectrum of mental health disorders across Tigray in healthcare workers and in teachers. So there are suggestions to help them heal, because teachers reach our children. Our children, when school starts, are going to be attended by the teachers. So the teachers themselves are distressed. Their mental status is not found to be healthy. So some interventions are very important to address this situation. Healthcare workers, likewise, they themselves are secondarily affected, or even primarily as a citizen of Tigray, they are affected directly and indirectly by the war. And they themselves need care, they themselves need treatment. So HAQI Foundation is proposing various proposals in a Care for Caregivers initiative. So let's care for caregivers. So having this an idea forwarded to you, please feel free to ask questions or discussions and comments. Getachew, please proceed.
Yeah. Okay. Thank you very much for providing me the opportunity. My name is Getachew. I'm joining you from the United States. So I have only 2 questions, but before proceeding to my questions, I would like to really acknowledge, the activities of your foundation. I believe it's a new intervention in Tigray, especially in a conflict-stricken area, even if it is a new culture or one of the untouched, I would say, aspects of spheres in the community. But it's really important to see, like HAQI Foundation, to do trauma and related tasks in Tigray. So yeah, I would like to thank for all of those who are behind the initiation. My first question will be, in your assessment, even if I believe this is the first and primary assessment, but in your assessment, what is the most prevailing mental health problem that you have gathered through the primary data? And the second question is, I heard from the explanation that the health, caregivers are themselves the primary targets of the all sorts of, the all challenges of the war, mainly the mental health problem. So what suggestions or what methods are you trying to suggest to address the trauma challenges in your institutions or in any healthcare settings as much as possible. And thank you very much for giving me the chance.
Thank you.
Thank you, Mr. Itacho, very much for the questions. So I would go to now Azad Ragai.
Hello. Hi, Dr. Fasika Ahmad Zada. I used to be Ma'ala University staff, and right now I'm just working at University of Agder. Sorry, I think my voice may not be clear. I'm just traveling. So I would like to say thank you very much for your initiative and for very interesting presentation. I do have a few questions. I'm not sure, like I'm not clear with what is HAQI done so far. If you give us some brief about your foundation, what you are doing, and what type of help or what type of things that you may need that we can ask, maybe from where we are working right now, just how they could help us or how we can have a collaboration with the university that I'm working in now. I'm just working at University of Agder in Norway right now. And the other thing is what have been done so far to kind of post-traumatic syndrome disorder for those who develop like that. So is there anything that you have been done so far? Or I need some brief description about your foundation. Thank you so much for your initiative. Sorry for my maybe sound. Thank you.
Thank you, Azad. Nice to hear from you. So we'll address if there are, I don't see hands being raised. So Dr. Zenawi, please respond to the questions that are forwarded, and then I will also give a brief description of HAQI based on Azad's question.
Okay. Thank you so much. Thank you, Getachew. Nice to hear your voice. Actually, I usually follow you on Twitter, and it's nice to hear your voice today. Well, most prevailing mental health problem. I think we don't even need to do any investigation because we're living in Tigray, we're living in Mekelle. We see the day-to-day behavior change among every one of us, every professional. So I think some of the mental health indicators are exactly what we really see in our day-to-day observations among professionals and among laypersons. So people are very much anxious, and it's not any different when it comes to the health sectors. But when it comes to the service giving professionals, you can imagine what it means. It's not just their personal life, they're also providing service, and they're facing people who are traumatized themselves. So especially in the healthcare centers, very high level of trauma, burnout, fatigue is becoming common. And perhaps as a result of that, and as a result of some other factors as well, people are starting to move away from Tigray as a coping strategy. Although I don't agree with this kind of a coping strategy, but at least because of all the challenges they're facing, we see some kind of a brain drain as a way out. So yes, trauma reflected in the indicators I just mentioned is the most common one. Why were the healthcare workers the main targets? I mean, it is anybody's guess, but in war, I think healthcare center is one of the priority areas where the enemy, as well as armed forces, would like to get service. So you can imagine the kind of burden the healthcare institutes will have to bear in such a situation. So obviously there will be the targets. So in the first place, the fact that they are providing services to people who are impacted by war is by itself traumatizing. But at the same time, in some situations, they were forced, I would say, to provide service at gunpoint. So you can imagine what it means to these people. So obviously they were being as the targets, even as compared to our teachers. I think the healthcare professionals were pretty much as the targets when it comes to the war. So this is what I can say to Getacheo's questions. Perhaps with regard to HAQI, I think Dr. Fasika can respond to Asade's questions. Thank you.
Thank you, Dr. Zenawi. So, Tigray has suffered from very unprecedented destruction because of the war. And this destruction is so huge, and it has resulted in unspeakable suffering for everyone. Not only those who live in Tigray, but those who live outside Tigray, because we are connected. We have parents, brothers, sisters, children. So everybody has suffered a lot. So this unspeakable suffering requires a well-thought response, scientific response, very structured response. So HAQI was born out of a question posed by scholars, researchers outside Tigray in the diaspora. So these individuals, they said, what can we, members of the scientific community, do to alleviate the suffering of the people, and then how can we help in the recovery and reconstruction of Tigray? This is the question. So they wanted to engage in evidence generation, in caring for caregivers, in healing, recovery, social transformation of the youth, and innovations in children, in education, everything. So out of this was born HAQI. So today I would like also to invite all participants to visit the website. Care for Caregivers is just one aspect of the initiative. It has a lot of other departments or domains where everybody who cares for Tigray can help. Just as you have said, there are a lot of activities that we are planning to conduct from your place of work. So by visiting the website, there are things that HAQI has envisioned, and this vision we want it to be shared by every Tigray and helps of friends of Tigray who wants to see Tigray recover and restore. So I invite you to visit the www.haqi.org website, and there is a place for you, for everyone who wants to be involved in the restoration. So we just want to contribute our share in the restoration and healing of Tigray. Tigray will heal, Tigray will restore with the help of everyone, not only a few individuals. This cannot be left for a few individuals. And then for the question, what have you done so far? It's a good question. So conducting the assessment, and even another research is also being conducted. And following this research, we are developing proposals and looking for funding agents. These proposals, we are advocating their importance. And of course, there can be other initiatives already taught by donor organizations. So we want to show them this mental health problem that teachers and healthcare workers have suffered can be mitigated, alleviated with this proposal. So we are still in the proposal writing and looking for funds. So we are also looking for other organizations to partner with, so that we'll have a common agenda to help Tigray restore. So in brief, what have we done so far is we have developed proposals, various proposals, and we are submitting them to donors. And we'll make the proposals transparent to see how you can help wherever you are, if you want to help. Thank you very much. If you have questions, I can give another round of chance for you to discuss, comment. So unmute her, and then let's hear from Azim.
Hi, I'm not sure if this question has been answered already, but is there any close collaboration as well with the, these counterparts like the Ministry of Education and Ministry of Health to make sure that they also participate in this process?
Thank you very much, Azir. It's a good question. So from the inception of this assessment and then the other even proposals, we are working closely with the regional bureaus of health and education. We also plan to share with the Ministry of Health and Ministry of Education so far, and we will communicate our proposals to them and we'll seek their help in these endeavors. But so far, we have not contacted them. But in the coming few times, definitely we'll communicate with them and bring them into the helping pool. Thank you for your comment and question. A Zoom user with an identified name with raised hands. Danny, please give him, unmute him, and if you introduce us yourself.
Yeah,
and
sorry, my name is Johannes. Mostly, you probably know me by my handle on Twitter. I'm calling from Europe, so but I'm sorry I joined late. I'm at work, but I wanted to ask you what are the short-term and long-term goals in just brief. I'm more or less concerned about the short-term goals in addressing these issues. Like something that we can, in terms of responding to the acute needs.
Dr. Zenawi, would you like to reflect on this, and then I can add, if Daniel unmute you? Yeah.
Sure. Thank you very much, Johannes. I think obviously we're more concerned now, as you rightly said, on the short-term goals, because we have traumatized healthcare workers and teachers, and unless we do something about their mental health, mental status, it's pretty difficult for them to be provide services as much as they should. So that's what we're trying to do in a short term. So this may include providing trainings to healthcare professionals themselves, or designing interventions intended to variously address mental health issues in the wider community, as well as in the health sector and in the education sector, starting from the schools all the way into the higher strata. So we would like the system to at least be responsive to mental health. As you know, mental health was the most neglected disease in the country. It was not given a policy priority. So our long-term strategy would be to make sure that colleges and universities give more emphasis, especially in Tigray, in war-affected other areas as well, to give more emphasis to training qualified psychiatric nurses, psychiatrists, and what have you. So mental health becomes an issue to be discussed at a wider level. So that will be our long-term strategy. But first and foremost, we have to make sure that these professionals are healthy and provide service to the community. Thank you.
Yeah, thank you very much, Dr. Zenawi. So our organization and the workers with us, we focus primarily on healthcare workers and teachers. So we started advocacy, raising the issue on international level that our teachers and healthcare workers are being affected, and then look for areas when, for example, in some like provide welfare issues, like meet their welfare problems, and then design for their psychological healing projects that can help in designing. As you know, mental health care workers are not very scarce in this part of the world. So instead of, we'll be focusing more on peer-based and task shifting to not briefly trained people. So there are various proposals we have proposed. We are waiting for funders and hopefully we'll get one very soon. So we have made it our purpose to help the caregivers heal. So with God's help, I'm sure by the next our next webinar, we'll report to you what we have achieved so far. So unless there is an additional comment or question coming, thank you. I would like first to thank again my foundation, HAQI Foundation, for enabling us to interact this level to undergo the research. So thanks to that, and then Dr. Zenawi and the team for conducting the research, for compiling it, and for even now presenting it, and for continue to work on it. So thank you very much, and all the participants for taking your time, for coming and listening to us. Again, I would like to repeat it for the third time. The size of the audience does not matter. I know people are very busy, but what we have discussed, we'll make it available in a video, on our website, and we'll share it on the social media. So thank you very much for your attention, and have a good day and evening wherever you are. Then we close here. Thank you.